My name is Dr. Mike Taylor. I'm a consultant paediatric neurologist, and I primarily work out of Leeds Children's Hospital, but I also undertake private work. For me, paediatric neurology was a very lucky career move. I first covered it during my on-call as a very junior paediatric trainee, and I knew I'd found my niche. I have a brother with autism and severe learning difficulties and epilepsy, and I'd always had an interest in the field, but never thought of pursuing it until I very luckily covered it as an on-call. The reason I chose it as a specialty is due to the fact that there's the great ability to investigate and put together a puzzle to offer a diagnosis. Primarily, I have an interest in complex headaches and epilepsy. However, I also like seeing patients with developmental issues as well, and trying to figure out, can I offer an answer for their problems? So naturally, it is a field that has lent itself to my investigative nature. The most rewarding aspect of my job is putting together that puzzle to offer a diagnosis. One of my major passions is also pediatric headache, including migraine. I particularly enjoy helping a young person reintegrate back to their previously normal state, especially whenever they've had very disabling migraines that have taken them out of school, out of physical activity, or really adversely impacted their life. I think it is an incredibly rewarding aspect to see that young person come back to my clinic and say that the impact that I have made has allowed them to re-engage with the very things that bring them joy in life, and also skill, which obviously may not. But it is an incredibly useful thing to see a pediatric neurologist with this, especially because people may not be familiar with some of the other treatments that are available for migraine. What do my patients value about me? My patients value that I'm honest. I will tell them what I think is happening. I will tell them if it's something that's slightly unusual and needs further investigation. And I'll also try and direct them to local services that may be able to help continue their care if it extends beyond what I can deliver within a private setting. My patients also value the fact that I will consider different avenues and a more holistic approaches, and that's really incredibly important in both patients with headache disorders and with epilepsy. I value the fact that my patients put their trust in me, that they'll work collaboratively with me, and that we can try and find a way forward to treat the underlying health conditions in a way that maximizes the quality of life and potential of each child.